Hey guys, it's Nisha the PA, and here we have today my beautiful patient 3 weeks post-op. Now, what we had was a revision supermodel lipo. Now, let me tell you a little bit more about my client. A few years back, she had a botched liposuction, which is the reason why we had to do a full tummy tuck this time. And we went ahead, you had a lot of scar tissue in here. We had to do a lot of liposuction to improve her results. I want you to take a look at her before pictures. She has these irregularities in the abdomen area, and that's a part of what happened with the botched liposuction before. I'll show you a little bit on the sides as well. A lot of irregularities that we had to clean up with our liposuction all over. Now, she had liposuction to the abdomen, to the flanks. We also did a little bit of liposuction to her inner thighs, along with Renuvion for internal heating, so we can make everything nice and tight. Now, I want to show you guys a little bit more so of her backside as well, because we did a little bit of fat grafting to the buttocks area. I'm going to have her turn just a little bit. So you'll see kind of from this angle, we did a little bit of fat grafting to the buttocks area to give her a nice round shape. Looks really good and natural.
Can you put your hands up, please?
Perfect. I really want you guys to pay attention to this flanks area, which we did, which is another part where we did the liposuction and internal heating on. She has a lot more smoother contour here. She doesn't have those irregularities that we saw before from her previous liposuction. If she didn't have that previous liposuction that gave her a lot of irregularities, then we actually wouldn't have had to do the full tummy tuck. But in this case, we did in order to maximize, to give her the maximum results. I'm gonna have her do a little bit of a 360, turn a little bit more. There you go, just so you guys can get full view of the front and back. So her buttocks is a lot more rounder than what it was before. Nice contour to it. And I'm gonna have her turn a little bit back to the front. And this is 3 weeks post-op, so she's done her appropriate amount of aftercare. So she looks really, really good. The swelling is down. Of course, she still has a little bit more swelling. It's only 3 weeks post-op, but because she did the appropriate aftercare, her healing is kind of expedited. As the months go on, she's gotta be a little bit more firmer, a little bit tighter here, especially if we continue with some of the body treatments that we recommend, like Venus Legacy, which will further decrease swelling, True Skull Flex, which is kind of like an ab workout. We'll do it to the abdomen. You can really do True Skull Flex anywhere, to the abdomen, the legs, the buttocks area. And those types of treatments, after you get a procedure like this done, will just maximize your results. It's kind of like going to the gym and getting the 45-minute workout. And so it's going to enhance the results that she already has. We can ask her a little bit about her experience.
How do you feel?
I feel great. I'm really happy I chose to do the aftercare. I feel like it helped a lot. I feel really mobile. I don't feel woozy at all. I feel like I can kind of resume my normal day-to-day activities. And I just also want to give a big thank you to the staff here because I loved working with everyone and everyone was so great.
Thank you. And a couple people are asking about the belly button area. The belly button area, that did have to get relocated with a full tummy tuck. We have to cut and we have to move it up just because of how much skin is removed.
But it still looks nice and natural, which is very important.
Someone's complimenting the curves. We'll show them there.
And a little bit of that scar tissue. She has a little bit of scabbing there. She's been using the appropriate products that we recommend to help with any type of any area that we cut or did an incision in. And once again, that's going to make this look really, really nice once that scabbing falls off in the next few days or so.
There's a couple people asking about the cost of this procedure. You guys need to consult with us. Everyone is different. You may not require the same things as someone else. So for to do that, you need to send a DM with your full name, email, and phone number. You can email us appointments@jasonmd.com, or you can go to emeraldcosmetics.com and book a consultation there.
That's right.
Now once again, this is our supermodel revision lipo. We did fix a lot of the irregularities in the abdomen area, as you can tell. We did along the sides, the flanks. We also did inner thighs and some fat grafting to the buttock. How long until she could walk after the surgery? Was it hard to walk to the bathroom after surgery?
I was up and walking the very next day, and no, going to the restroom was not difficult for me at all. So.
Guys, with the appropriate, it's not only that you have someone that you trust doing your procedures, but with the appropriate amount of aftercare, recovery time is really expedited. So a lot of our clients, the very next day, they're up, they're walking around, they're getting their fluids, they're doing their hyperbaric, they're doing their lymphatic massage. All of this is a part of the recovery process, and it's the reason why at 3 weeks post-op, a lot of our clients look so great because you're doing everything that's recommended to make sure they get the results that they want and that we advise.
All right, guys. Thank you for joining us today. Thank you, Nisha.
All right, guys. See you next time.
Bye.
Bye.